CDC recommends that 200 square feet is required to accommodate 2 to 3 technologies. In other recommendation, 8 to 10 linear feet per technologies is required in clinical laboratories. Eye wash station must be centrally located so that easily can be accessible in within 10 seconds or 100 feet from each working area. The cold water is also must be available in the eye wash so that for the emergency flushing of eyes because to slow the reaction of a splash chemical and construct the blood vessel to minimize the chemical absorption and also reduce the pain. Lab temperature must be 68 Fahrenheit, which is 20 degrees centigrade, to 72 Fahrenheit, which is 22 degrees centigrade, and humidity is 40 to 60%. 85% of air must be exhausted by unidirectional air flow. Regime is basically detection of a Worseman reaction or related reaction, some of antibodies which are associated with certain type of the hypersensitivity reaction. It may be contained in the serum, causing the Worseman reaction or other related reaction. L-form are the cell wall deficient mutant, and prozone are mostly used in the ELISA positive control preparation. And prozone is the phenomena in which the integer antibody reaction is only when the serum is adequately diluted, but not when it is used in the concentrated form. Incineration temperature is 870 Fahrenheit to 870 degrees centigrade to 980 degrees centigrade. Autoclaving is 1 to 1 degree centigrade, which is 250 Fahrenheit on 15 psi at 15 minutes. For medical waste, the autoclaving procedure is different. It required 132 degrees centigrade, which is 270 Fahrenheit on 15 psi at 30 to 60 minutes. The dry heat is 1.5 to 3 hours at temperature of 160 to 180 degrees centigrade. Filtration is through cellulose acetate or cellulose nitrate membrane with a vacuum. Filtration of the air is accomplished using high efficiency particulate air filters designed to remove the organism larger than 0.3 micron meter from the isolation room operating room, which is a biosafety cabinet. Ionizing radiation used for the disposable, such as plastic syringes, cathedral gloves before use. Formaldehyde vapor and the vapor phase hydrogen peroxide is also used for the sterilization purposes. It's basically formaldehyde vapors and vapor of hydrogen peroxide is oxidizing agent used to sterilize the HEPA filters in biosafety cabinets. Glutaldehyde and peracetic acids are two chemicals that can destroy the spore. Basically, they are sporocidal. They require 3 to 10 hours and mostly apply to the medical equipment such as the bronchoscope, lenses, rubber, metal, and this process is called cold sterilization. These are three terms. One is anemistic, is a rise of an existing antibodies, and pelobroplast is a basal body structure in the hemoflagellate from which the exons arise, and candling is the inspection of an unbroken egg by holding it in the front of the bright light source to know whether the embryo is alive or dead. In the clinical microbiology, frequently acquired laboratory infections are Shigellosis, Salmonellosis, tuberculosis, brucellosis, and hepatitis. In 1986, Environmental Protecting Agency published a guidelines substituting the less hazardous chemical when possible. For example, the humide should be used in place of xylene in trichrome strain. Separating the infectious waste from uncontaminated paper trash. Infection waste of a microbiological media should be placed in the leak-proof bag known as the double bagging. In 1987, the CDC published the guideline known as the Universal Precaution to reduce the risk of hepatitis B virus transmission in the lab in 1996, these recommendations become standard precaution. These standard precautions do not apply to the feces, natural secretion, and saliva except in the dental procedure. NIOSH is the National Institute of Occupational Safety and Health. It's a branch of CDC that approve N97, N95, and P100 masks to be commonly used in the clinical laboratories. If needle stick injuries or exposure to the patient with the Neisseria meningitis or other unknown infection, the follow-up should be observed during the follow-up should be assessed, drawing additional sera at the interval of 6 weeks, 3 months, and 6 months. Mailing the biohazard material and category A infection substances. Mailing biohazard material is considered as category A biohazard, and that is infectious substances, mostly tuberculosis, mycobacterial tuberculosis. For both diagnostic and chemical and infectious substances must be triple bagging with the absorbance material, watertight, hard plastic material, and then be again packed in the fiber board. And specimen transportation for the all type of the clinical specimen within 2 hours after the collection. Preservatives are boric acid in urine, polyvinyl alcohol, and buffer formalin in OVA and parasite examination. Certain anticoagulant is used, like they are yellow top containers, sodium polyethanol sulfonate (SPS), which is used in the bacterial culture. Heparin is commonly used for the viral culture. Also, it will inhibit the growth of GPC and yeast. The green top container citrate tube is not used for the microbiology. Anaerobes are a major group of bacteriology. Anaerobes required 80 to 90% of nitrogen for their growth. So almost all the anaerobes are strong nitrogen fixative. Capenophils are they required 15% oxygen and 5 to 10% carbon dioxide. Neisseria haemophilus species are capenophil. Microphils are like Campi, Helicobacter. They need reduced oxygen, not 15%. They need 5 to 10% and increase carbon dioxide in the microphils. That's are 8 to 10%. The test complexity model. The test complexity model, there is one phenomena we called it VIV test. It's a simple test. If it is performed wrong, and it will not affect the patient. Like the sample to perform that, there is no risk to patient, even if the test is not performed correctly. For example, these tests are non-specific tests like streptococcal group A, influenza direct antigen, HIV antigen from saliva, and biological safety cabinet have HEPA filters which diameter is 0.3 micron, and they have different class. Class 1 is open front. This class cabinet allow the room unsterilized air to pass into the cabinet and around the area and the material within the cabinet. In the class 1, the sterilization is only the air which is exhaust outside, and they have the negative pressure and which are ventilated to the outside. In the class 2 cabinet is divided on the inlet flow velocity present of the air that is in HEPA filter and recirculation into two groups A and B. In class 3 cabinet, it offered the most protection to the worker because the rubber gloves that are attached and sealed to the cabinet and filtered are completely sterilized. Classification of biological agent based on the hazards. CDC booklet titled Classification of Biological Agent on the basis of hazardous served as a reference for the assessing the relative risk. In biosafety level 1 agent include that have no known potential for the infecting the healthy people used in the microbiology teaching exercise for beginning level of microbiology student. In the biosafety level 2 agents, biosafety level 2 agent include the common agent of infectious diseases as well as HIV. The bioterrorism agent in this biosafety level 2 biosafety cabinet 2 level is Bacillus anthrax and Yersinia pestis. Biosafety level 3 procedures is recommended for the harboring the viruses and also culturing the mycobacterium tuberculosis and mold stage of systemic fungi. The bioterrorist agents such as Francella tularensis brucella species are categorized in the BSL-3 agent mostly transmitted through the aerosol. The biosafety level 4 agent include only certain viruses, arboviruses, arenaviruses, flu viruses group this is not found in the United States. The bioterrorism agent in this group biosafety level 4 are smallpox which is transmitted through aerosol. No vaccination or therapy are available for such organisms. For sensitivity, to check the sensitivity of the test, we have a formula that true positive divided by true positive add by false negative multiply by 100. Sensitivity is very important. The greater the sensitivity and the greater the test is reliable. In sensitivity, if we take the example of respiratory synovial viruses with antigen test that is usually done in infant, have 99.9% of sensitivity, which lead to the true positivity. Specificity is true in specificity formula is actually the true negative divided by true negative plus false positive multiplied by 100. Again, we will take the respiratory synovial virus antigen test as an example. In this test, if it is negative, we'll consider the true negative. And we will consider other possibilities like Bordetella pertussis and parainfluenza viruses. Prevalence is the frequency of a disease in the population at given time. Prevalence is like true positive adding the false negative and divided by the total number of isolate multiplied by 100. Prevalence is important in comparing the positive and negative predictive value. And the predictive value positive or positive predictive values are very similar to the sensitivity. In the sensitivity, we positive, true positive and true positive, but we also add the false negative. But here in the positive predictive value, true positive divided by true positive added by false positive multiplied by 100. Positive predictive value is the percentage of true positive results. And predictive value negative or positive predictive value or negative predictive values are true negative divided by true negative plus false negative multiplied by 100. Predictive value negative is a percentage of true negative result. Efficiency is accuracy is a percentage of the tests that are correctly identified by the test, like the true positive and true negative. Efficiency is confused with the prevalence. Like in the prevalence, we multiply, we have a formula, the true positive plus false negative divided by total number of sample multiplied by 100. Here in efficacy, we use the true positive plus true negative multiplied by total number of isolate divided by total number of isolate multiplied by 100 is efficacy. Further, we will talk about the quality control in the microbiology and the clinical laboratory. Performance improvement, PI. PI is a program. In this program, the total quality management came, and this total quality management is further divided into the laboratory monitoring. In laboratory monitoring, the further two branches. One is quality control, which is internal activities, and quality assessment, which is external activities, positive patient outcomes. The continuous quality improvement is umbrella term which encompasses the whole institution quality program. This quality program is further checked by the accreditations. All the lab have minimum requirement that they must be accredited from the clinical laboratory improvement amendment, which is also called CLIA 88. It is first implemented in 1988. So the College of American Pathologists, CAP, and the Joint Commission of Accreditation of Healthcare Organization, JECO, and also the Commission of Laboratory Accreditation, COLA. The quality control in the clinical microbiology susceptibility testing is explained here. In each susceptibility testing system in use must be tested within 20 days period. If the zone of inhibition diameter are outside the reference range, laboratory must switch to the weekly QC testing. If no source of error is detected or uncovered, 5 consecutive days of retesting is recommended. If precision is acceptable, switch to the weekly QC. If still the error is coming, then the 220 consecutive day of retesting is recommended. Here we have the determination of a test reliability, a standard error formula in which the P is the sensitivity of the test and N is the total number of a sample. If the standard error is decreased, the test reliability is increased. There is another species of a bacteria that is called Agnostchineria species, is associated with the flesh fly, Wolferia magnifica, and this is my goat covering wound. If a guy have my goat covering wound, and this bacteria must be there, causing the wound infection, which later on lead to the bloodstream infection. Grow on McConkey blood chocolate oxidase positive non-motile catalase positive. Identification is through 16S ribosomal RNA. The bacteria is asaccharolytic that cause the myiasis, an infestation of a larva or mygotes that feed on the host dead or living tissue. Shelf life of the media, expiry of the plate media is 1 month and from the date of preparation, and 6 months for the tube media from the date of preparation. The bacteria stock may be maintained by freezing it for the 3 years in 10% skim milk, streptococcus soya broth, 15% glycerol, 10% horse blood, and in sterile screw cup container. Stock isolate in bacteriology, which is non-fastidious like yeast and rapid grower aerobic organism, can be saved up to 1 year in streptococcus soya agar. Lyophilization, freeze drying or freezing at minus 70 degrees centigrade, frozen of 5 years. For fastidious organism, refrozen after each 3 years. For the mycology stock culture, molds can be stored at 4 degrees centigrade for 6 months to 1 year in potato dextrose agar. For longer term storage, PDA slant overlaid with the sterile mineral oil and store at room temperature, or sterile water is added to the sporulating culture plate. This water is then put into the screw cap tube at room temperature for the lifetime storage. In Mycobacteria, 4 degrees centigrade may also be frozen at minus 70 degrees centigrade in 7H9 broth with glycerol. In virology, the viruses may be stored indefinitely at minus 70 degrees centigrade in the solution containing cryoprotectant and 10% dimethyl sulfoxide DMSO or fetal bovine serum. In parasitology, the slide and the photograph must be available for the QC purposes. The trichrome and other permanent slides may be preserved indefinitely by adding a drop of the permont and a cover slip.